Get your glasses, make sure you can see the fine print. Sign your life away. You know?
Do we really need our glasses? Oh, okay.
Come on. You know me, I just joke the whole day.
Oh,
So it
okay.
keeps me entertaining myself.
Yeah,
I see.
You see, oh,
He
good.
thinks we're boring him, so he's by his bed.
Up on the bed, take a nap for you guys.
While we talk.
So today is the low back exercise workshop to help increase your strength and be pain-free. Why do I do this? About 70% of my patients, 70% of my patients come in with back pain. Who has not had back pain before? I have had back pain before. I know you have back pain before. Everyone's kind of suffer back pain. How do we recover from back pain so we can get strong? Then, because of strength, stay pain-free. That's the overall plan. Okay. So just to jump into it too, what are most causes of back pain? These are my top 3 most causes. Posture. With COVID, how many people sat at home all day? It looks like this. Okay, yeah, it looks like this all day. No. People go from here after lunch, they go from here. End of the day, they go like this. Done. Okay? We got to get the body to reset here. We'll talk about over time how to do it. Here, so once we get our back strong, we can stay here. Our back is weak, we naturally do this because it feels better, and then it causes other problems, headaches, neck pain, shoulder pain, everything else. During COVID, this is June 2023, during COVID, last couple of years, I've had so many neck problems, back problems, people sitting so much. And again, not knowing how to sit, or they get tired, they can do this. All right? So number one thing is posture, standing, sitting, or even walking. So if I'm walking, am I walking hunched forward? Am I walking back here? We'll walk through how to check your posture, then get it there and keep it there. If we can walk better, we get our back stronger, maintains that strength and endurance so we can sit more, stand more, do everything more. Right over there, save those spots. If you want, it's up to you. Good.
What is this, Sylvia?
This is the low back exercise workshop.
I probably need that, but I don't have the time.
Not a problem. Enjoy your time. Good luck. Your tight schedule. Good luck. Next one, exercise-induced pain. Okay, I had 23 exact low back injuries from people that had gone to the gym during COVID. The gyms closed for 6 months. Tried to go back right away. Boom, they hurt their back. If we're rehabbing our back or not used to a workout or a routine, you got to give yourselves time to get used to it. If I do one of the yoga classes here, Pilates classes, if I'm not careful, I can hurt myself, even though I work out every day, because I don't do that every day. So when you do something for the first time, second time, third time, give yourself a chance to actually get used to that workout again. Whatever, even dancing. If I did dancing today and I tried to go for it, I'd probably hurt myself. I want to make sure I'm doing myself, taking care of my body by getting in something new, activity, slowly, then build it up over time. Right? Exercise-induced pain. Lack of flexibility. Okay, I have a lot of people in my office that have very physical jobs. Unless we stretch enough, we lose that balance of flexibility and strength. Unless we stretch enough, we have more strength, less flexibility, a chance of injury. We have to make sure our body is flexible along with strong so we can maintain our movement patterns, our quality of life, and again, not cause injuries. And we'll go over how to do it today. These are my patients I walk through a patient with, exactly how to get better, but over a period of 3 or 4 weeks, I'm going to give you a condensed version within 3 or 4, hopefully by 1 o'clock today. I want to give you all my exercises today that I give my patients that deal with back pain that go from being pain, back pain, you sometimes even nerve pain down the leg, for example, to where the pain goes away, but we also increase flexibility and strength with that patient so they don't have pain come back. Once you learn these exercises, these are magical, I'm going to call them magical, they'll make your body stay loose and strong all the time. When you feel pain, you can go back to them again. Okay, what am I not doing right? What am I doing? What feels tight? What's so uncomfortable? You go back to these as a way to reset your body every time you do have, say, for example, back pain. All right, go right into it for 1, 2. So what we want to do is increase our stretching and flexibility to start, increase over time. And once you've done that, phase 1, phase 2, increase strength and endurance, just body weight initially with my patients, then over time, if need be, with weights. If someone has a physical job, they're lifting, for example, steel all day, working the yard all day, digging dirt all day too, walking as a male man or male woman, at that point you want to have their body strong more than your body just weight needs to do. Meaning that you want to test it with adding more load so muscle can actually build up muscle, not just by body weight. Okay? So go into it too. How do we stretch our back? Number one thing, if someone's in pain, I'm going to focus with them lying down first. At that point, there's no load on their body. I forgot to do my models. Your lower back here, your lower back, what it does, it actually holds 80% of your body weight. 80% of your body weight of your upper body goes in your lower back. You need that strong as possible. When we're trying to do exercise or stretching, standing or sitting, that's too much load to start. If you do everything lying down to start, then we add more load, more weight to make it stronger. So let me change the camera around here. So get this thing where it points properly to me because I'm the star of the show. Sorry. Just being humble. All right. Here, here we want to do, first of all, is a low back stretch. The low back stretch entails putting I use this as a half roll, but a rolled up bath towel, any color you want to use. Okay, the joke? Any color you want to use. Okay? Bath towel, put them on your lower back right about here. Right above your belt line for one. And let yourself lie down over that rolled up bath towel. Let your body sit there with your legs flat, just like this. What the roll will do is actually allow your back to decompress over the back, over the rolled up bath towel, to make it separate and stretch that back. Because you're lying down, there's no vertical load on your body. It allows to stretch even more over time. If that feels good, then you want to do is bend your knees. To add a little more pressure sometimes it will, to make that back stretch a little bit more. How long should we stretch the spine, you think? How long should we stretch the spine? Just to start though, what's a good starting period?
Yeah, but can I ask you a question?
Yes.
Wrong time. How do you get up?
I have a workshop from 2 months ago. You can watch that workshop. So if someone's going to get up from the floor, so just as a side note, the floor, I'm going to have them do is go to one knee and then both knees, and if possible, go up to one leg and push off with your hands all the way up. If not, use a chair.
Well, what is
Yeah.
I do that, but I crawl all the way from the
So what I would do,
kitchen to the living room, but then there was nothing substantial enough to grab a hold of to climb up.
so to start, what I would do as a modification is do it in bed.
Oh,
So instead of the floor, do it in bed, but and if this seems like it's too soft or doesn't really push on your back to stretch it out, to separate it, to move it, or to get your back to stretch, maybe add a second bath towel.
okay.
Because the bed will sink in a little bit too. You got to be careful of that.
Can it be anything else?
Anything else you want to use, and as long as
Can it
it's
be
round.
wood?
What's that?
Well,
Can
my,
it be wood?
I would do something more soft.
Someone gave me one. It's a part of a set.
Yeah.
Yeah.
And as long as you put that pillow rolled up bath towel or something on there that's arched, and it makes your muscles not want to tighten up. That's the goal with stretching, right? If we're going to stretch, we want to make sure it's not going to make the muscles tighter. It's going to keep the muscles looser.
But you're gonna do exercises when you lay down like that, or you just gonna lay there?
You want to almost lay there. It's very simple. Give it time. You want your back ligaments here, these back ligaments in your spine here to open themselves up. So you want to give them time to stretch. What I tell people, differentiating muscles to ligaments, muscles need the movement to stretch. You want movement to stretch the muscle, to warm them up. The joints, where the ligaments, you want to hold that stretch so ligaments can actually stretch under tension to allow ligaments to become more flexible, whereas muscles need the movement to become more flexible. So you want to hold that stretch when you're doing it. You don't want to continue moving all around. So legs up and legs down, that's all you want to do. All right? Does that answer your question? Yes.
now what about the round one? I have a round which is long, this long, but this round.
Is it soft or is it?
Soft.
Good, go for it. Go for it.
Oh, I can use
Yeah,
that.
it's not the length, it's the width, it's the diameter, how wide it is. You want to make sure it's wide enough where your back, even if it's in bed, it feels like a stretch, but not a tightness to where it makes your muscles want to guard.
Okay.
Muscles guard is causing more pain a little bit. It's going to make things tight and not relax. That's that gray area you have to use on your body. With my patients, what I'll do is test them in a room, something like this, or maybe something a little bit more thick, and see what they can handle.
Thank you.
You're welcome, but in bed's fine too, as long as it feels like your high's gonna stretch. All right? Second one here is leg bent back stretch. Different angle for this one too. Different angle. make it more exciting. Right about there. So here is one I start doing my patients to make that lower back here stretch with some rotation, some torque, not just up and down. What I mean by this, I'm going to have you take that rolled up back towel, put it over there. Don't be that aggressive if you don't want to. It's up to you. Okay? Want to lie all the way down. I'm gonna stretch my left side of my back. I'm gonna anchor my right foot, bring my left knee over my right knee, hold it there for a second, make sure my foot is anchored. I'm gonna use my right hand on my left knee, let that leg come over. Use my left hand more for stability, more for support. Let that leg come over to my side. All right? And just hold that for about 30 seconds to a minute. And some people, what I'll do is have them do that stretch, and I'll help them a little bit, and I'll see their face. Why do I want to see their face? I want to see at what point do they start to grimace as I bring the leg over and tell them, okay, we'll stop there. This will be your starting point. So wherever your face starts to go, oh, that's a little uncomfortable, start there first, because you're going to stretch that TFL band, the glute, the back muscles together, because they all work together, correct? Let's stretch them all together and come down where you're comfortable. Hold that for 30 seconds, then come back, then switch sides. Again, if I'm doing my right side now, all I'm going to do is anchor my left foot, right knee over my left hand to my right knee, right hand on the side of me for stability. Let that leg come over and let that leg rotate out. Allow that lower back to stretch even more. And everyone's going to have a tighter side more than the other side. So you want to hold the tighter side maybe a little bit longer than you would the side that's not as tight. All right? 30 seconds both sides to start and work up to a full minute. You can do this one in bed also versus on the floor, so whatever works for you. It's a free country. All right? Whatever you guys want to do. Any questions on that one? Simple but effective, Ken. Effective. All right? So 30 seconds both sides. Next one. The Cobra. Who's done a Cobra before? Okay. Cobra stretch. Different modifications. To start, make sure the camera's still on me. Star of the show. Good. Right here. I'm going to do for the Cobra, I let the bed's fine. I'm good with the bed. Okay, or the floor. To start, you want to do, if our body is stuck in flexion, hunching forward, you got to slowly extend backwards to make the back loosen up and also get stronger over time. Okay, so what I'm going to do, if I'm going to have someone do the Cobra for the first time, they have a lot of back pain, I'll have them do this. You guys get it? All right, take a nap if you want to. Okay. For some people, excuse me?
I don't understand how you get up from that position.
So in bed, it'd be easier in bed. I'm good with the bed. So here, if I'm going to be here, this may, for some people, may not be enough extension. If their body's used to this might feel uncomfortable to them. Just to lie in their stomach. So what I'm going to do is have them, how does this feel? Patient John or Jane or Joe or whoever it might be. Okay? I'm here. It feels okay. And here, if this feels okay, I'm having to do is come to their elbows and see how that feels. Does that make your back tight, sore, uncomfortable? It feels okay. Maybe 30 seconds here. This feels good. Next I'm going to have them do is go up to their forearms, make their forearms straight to a full Cobra. If they can. Here you're going to stretch out your lower back, but also if my body is tight here, does this make sense? At that point I'm going to have tight thighs, tight abdominals, tight even chest. So as I go further up, going from here to here to here, I'm stretching more of my front abdominal muscles too to make my whole body extend into better position extension. Just relaxing, you're not pushing up, relax this position if you can. But if you feel good here, feels a little stretch, fantastic. Feels here, a little bit of a stretch, fantastic. Just work what you can work. All right?
You're just saying just lay there.
Just lay there. Too simple, I know. Too simple. Easy to do. You might fall asleep. Maybe lying down, but not this position. All right? Those are my common stretches I use for my patients, but doing them every day is the key, right? I'm gonna close this out of here. I'm gonna grab one. Just for a quick intermission.
Oh, thank you.
You got it. So any questions about the stretches? The low back roll stretch, the leg bent over top stretch. Again, this one here. Boom, boom, boom. Here. And also the Cobra. Does that make sense how they work? Any questions about that? Again, why am I doing them lying down? Because you can't hurt yourself that way. We'll get through other ones too. Lying down has to be the number one thing to get things going, then we'll work on other ones. All right? Next one. As you talked about earlier, how do people walk? All right. Here. Let's go here on the wall first. There we go. Okay. This is a wall one that some people do. And I usually have a flat wall, but this one's going to work. Here, I'm going to have them do, I want to check their posture. We talked about people, some people, they feel like they're normal. They feel good. This is their normal. Here. Go. That's good for you, Johnny or Jane, whatever. At that point, but if you want a better back, if I'm here, where's all the pressure? What's keeping me from falling forward? Your back muscle's working too hard. You got to get the spine to realign here so your spine sits at a better angle to hold your body up versus gravity versus your just overall body mass and you want to call it tension. So what I have people do to check their posture versus standard posture is go against the wall, hold that position, and see how that feels. Where do they feel tension? Is it shoulders? Is it neck? Is it lower back? Some people say they can feel like they're falling backwards. Why is that? Their brain has made their balance point here. This feels like they're going beyond. In their mind, this is too much extension. This is too much going backwards. So I want them to feel I want you to get here over time, make your back looser and stronger. I'm going to have you not stand against the wall all day because that'd be weird. I'm going to have you do a stand. Then put the weight on your heels. So we're walking this way on our heels, not on our toes. Oh, simple things we can do. Magical, simple things. So if I'm standing, I want to stand on my heels, so now my back muscles will fire a little bit, and make it a little uncomfortable to get them stronger over time. So I can walk this way instead of walking this way where it causes more pain. Okay, so when I walk too, I want people to understand, we want to walk with a certain gait. What I mean by gait, people to walk, so when they're walking, yes, leaning backwards on their heels, but also walk over with a patient who had bad knee pain earlier, is where you walk heel to toe, rolling your feet. Why is that important? The problem when you have pain, for example, recovering from pain, what we'll do sometimes is we'll do this and start to stomp, start doing this because it feels easier on the back or the hip. Problem is now the back and hip get better, but we've now in the habit of doing this all the time. We've been shuffling your feet too. I tell my patients, I don't want to hear your feet. I want to make sure we're doing enough rolling of your feet, your body up, weight of your heels. We're rolling your feet the whole time, not stomping and not pushing on the front of the foot. If I push the front of my foot first, what happens? All the pressure is here and here. Rolling my feet, there's no pressure in my back or my hip. It's normal gait patterns. When you have a knee problem, okay, if that doesn't feel right, where are the other problems? This back problem might lead or come from a knee problem or a hip problem, even a foot problem. So when we look at a back problem, when I look at a back problem with a patient, I want to see what's going on with their gait, their position, and also where is the pain when they have proper position. Is it the knee? Is it the hip? Is there previous injuries they had before they have foot surgery before? That one, how do I look at their overall well-being of that person, make their overall better, even though it's the back problem. What's the cause of the back problem? Questions? Make sense? Yay? So, again, just to check for your own self, check your posture against the wall, hold for 20 seconds or so, 20, 30 seconds. See what feels tight as your lower back, your shoulders, and hips. Then, come forward, off the wall, weight on your heels, then roll your feet slowly to really test it. Does that back feel okay? And then if it feels good, maintain that walk in that better position, even just your normal day, because as we lean back more on our body, the muscles work harder. Muscles work harder. What happens to muscles? They're working harder. Muscles work harder. They relax and get stronger. Relax, get stronger. If my muscles are stronger, they relax more. They work together. If I walk better position, my muscles naturally get stronger just by walking. My normal body weight. Nothing no additives to your system. No ketchup or salt or pepper. All right? Next one, wall hamstring stretch. One of my favorite ones, especially with someone, if you have a bad back, what happens to your hamstrings? They shorten, tighten, perfect, good. Oh, gold star free, if I had gold stars left. Okay? They shorten, tighten. So what happens is that if I'm short, tighten, I'm like this. So I want to make the hamstrings back here, hamstring connect from your glute to your feet to your back of your knee, make them looser. What I have people do, go against the wall, hamstring stretch, feet off the wall. What I'm going to do is lean from my hips, lean forward, tilt forward, hold where it feels so comfortable in my hamstrings, hold for a second, use my hands for balance, then slowly, using my shoulders, come up and touch the wall. When I come up, what I'm doing is actually making my back muscles work more. Because my back's on the wall, I can't hurt my back. Like being on the floor, I'm supporting my back by being on the wall. So again, hamstring stretch, and coming down, hands on your thighs if you need to. Hamstrings feel tight. Hold for a second, and come back up. Touch the wall with the shoulders first. And use just your back muscles to come up. That's uncomfortable. You can do as modification when you're coming back up. Use your hands to walk yourself up all the way. All right. Questions? I like 3 to 4 times. Pretty easy, 3 to 4 times. Get used to it. Here we go. Come on over, ladies. That's okay, you're good. You're on California time, that's the issue.
Yes.
SoCal time.
Okay, thank you.
Okay, so now, the wall squat. I did something with someone this week too, a modification wall squat. These might be okay. If I'm here on the wall, what I want to do is, in the wall squat, I want to again support your back, your low back on the wall, here, feet off the wall. There's a little border here, but I'll be careful with it. What I want to do is slide down where my back feels uncomfortable, my quads tighten up a little bit, and push myself up off the wall, all the way up. You may not want to lock your knees out, it's up to you, but again, your back's on the wall, hips on the wall, put your hands here for support, come down where you feel uncomfortable, keep your hips above your knees, hold for a second, and come back up. Okay? And one thing you want to not do, you don't want to bounce. Just pop your knees that way, that'd be bad. If you do that, you can see the video from me, see someone else. All right? But I want to do again, wall squat, simple things. Come down where it feels a little comfortable in the legs, in the back a little bit too. Hold for a second, and come back up. We talked about a second ago, if my back hurts, my hamstrings shorten. My quads get tighter. If muscles are tighter, they're weaker. If they're weaker, they have less endurance and cause pain. Let's get them looser first, and then stronger. Make sense? I tell my patients, as long as I sound confident, you guys will buy it, so we're good. All right? Next one. We're getting through this pretty quick. Modified kickback. I'm going to give you both today. I'm going to give you a bonus today, okay? Do the modified first, then we'll go over actually how to do the full kickback. So, the modified, camera check. A little bit closer for this one. Camera check, okay. So here, Modified. I want to do it standing, take the pressure off the back. You can do getting up and off the floor. The bed is kind of hard to do for some people. Here, I'm going to just put my hands on the wall, again for balance. I'm going to do is raise one foot. I'm going to start with my right, up on my toe, just to kind of see how that feels in my other hip. To have my balance through. I'm going to do is bring that foot behind you a little bit and bring that foot up. If you want to start just by bringing that foot off the floor, go for it. It'll still activate the muscles back here, as you bring your foot up, but also here, so your hip doesn't pop out. Okay, these muscles work well, again, with walking up here instead of walking down here. If I'm gonna walk up here, I need these muscles strong here, muscles strong here on both sides to make my back stay back overall. So again, modified kickback, hands on the wall, bring the right foot up to your toe, hold that for a second, your balance on the left and right hip, bring that toe up, hold that for 5 seconds, or if you're comfortable, bring that toe and that foot behind you a little bit and up as an arch to make those muscles work harder. Again, it's always up to you. I'm gonna do my left side again. Left side, bring that left toe up, hold up just for a while, make sure both hips feel good. At that point, now bring the toe off the ground. Here, that left toe feels good. That feels good for 5 seconds. Bring that left foot behind you as an arch to hold that position, bring it for 5 seconds. Okay? Any questions about that? It's one word. Okay, my back feels less painful. I want to get my back strong. The walking feels good. Everything else feels good. Now I can do more things to isolate these muscles and get them stronger. Questions?
How long should you do
Good.
each one?
I like 5 seconds both sides, 3 times. 5 times 3. At that point, it gives you a chance to really work both sides more, and again, twice a day. If someone's will ask me, well, I like to walk, when should I do my exercises, and when should I, if I have, for example, pain, when should I do my icing or heat? I always tell them, bookend your activity with the stretching first, exercises first, and then your activity, and then ice your heat afterwards. That's what your doctor, chiropractor, whatever tells you to do. You want to make sure whatever activity you're going to do, okay, how do I stretch beforehand, muscles warmed up, activity, and then make sure I cool down also. The problem is if we don't cool down, we have problems, we don't take care of past activity or exercise, we just go sit there and watch TV or something, you'll get up like, oh, my back's sore. Because when you have a chance to rest after activity, it's going to swell. You're not going to feel that swelling, that swelling in your spine until you go to move. Yes, ma'am?
Is that when we get like a pinch?
Mm-hmm. That pinch, you go, what the heck's that? That's what we want to avoid, that pinch. So see, come up with me? Yep.
Oh, no, first.
No,
Her name is Sylvia.
So good, Sylvia. Sylvia with the pink bird on her shirt. All right?
I always try to bring somebody else.
Yes, good for you. So, modified kickback. Okay? Scroll more. Want you near me. Bring that left toe up. Head up. Bring that toe off the ground. Feels good?
Yes.
Bring that foot behind you more. More. Hold it right there, Miss Gymnast. How's that feel? Good work. Wow, look at that. You're bouncing up and down. Switch sides. Other side now. So right foot up. Right foot off the ground. And right leg back. Up. This one's stronger or weaker?
It's weak, girl.
Yeah, you can tell.
The right is stronger.
Do you feel it just here or also here when you bring your right foot up?
Oh, I can feel that.
Felt okay?
Yes.
Good.
Yeah.
Good.
Yesterday I did some pinch stuff, right?
That's right, I worry about it. Probably you sometimes. All right? So now the full kickback, which you don't have to worry about this if you don't want to, no big deal. So here, I'm going to do here. Want to do the full kickback is it's hard in bed, but it's possible. You want to do is go on your hands and knees. Then from here, now head up the whole time. Always go head up because it's good posture.
Can't do that.
And now bring your one knee up, all the way up. Hold for a second, or 5 seconds, sorry. Then come all the way down. Body, and again, my body's not doing this. My body's gonna stay still the whole time. Use my muscles, my core muscles of my hip, my lower back and core to make everything stay straight as I bring that leg up. Hold for 5 seconds. Bring that leg back down. And then here, same thing. Hold for 5 seconds. And then come back down. Any questions?
Is that the same exercise as that one?
Same one. This is the full kickback. That's the modified. Easier, especially if someone has a knee problem.
Yeah,
At that point, it'll allow people to work their back muscles still without causing more pain.
yeah, my knee replay doesn't let me do that.
Yeah, that's why I always have the
But
modification.
they showed me that exercise for, I just had the knee replaced
Yeah.
about 2 months ago, and they showed me to do that way, just to
Good.
bend in the knee.
Yeah, and you
know.
want more range of motion, more movement.
Oh, okay.
You know, even other things you can do to slowly get it stronger. So for yours, come up to me with 1 second. Other Sylvia. Other Sylvia.
You asked for it. I don't want to ask questions now.
Too late.
Too late.
Too late.
Yeah.
So here, I'm gonna have you do, good, right here. Have you go right here.
Uh-huh.
Right here, I'm gonna have you do, just hold this for me. What I want you to do is, let me make sure it's
You're
wide
not
enough.
on the camera. I can see it.
Okay, perfect, perfect. I'm gonna go a little bit wider. There we go. I'm gonna have you do, Sylvia, is I want you to do, come down slowly, and then come down, and
Oh.
does that feel okay?
Yes, I feel okay now.
Good, you feel okay?
Yes.
Does that hurt the knees at all, the knee replacement?
No, because I just doing, since I have 3 hours after, I just start doing mini ones.
Right after surgery, boom.
Yes, they told me to do it right away.
Perfect, good,
And I
good,
did
good.
20 every day.
Good,
you
so
know.
right now, I want you to do is try this too. Let me get a chair here. Use
Okay.
this chair.
Mhm.
Here. What I'm gonna have you do now, I'll demonstrate first, is come down where it feels a little uncomfortable.
Oh, okay.
And now come up here. And see how that
Okay.
feels.
I
Just as an
hear
extra
that.
thing.
Yeah,
Extra
okay.
thing.
Yeah, okay,
Yeah.
that's
Where does
what
that
I want,
feel?
that, I feel good, yeah.
Good. Again, this
I
is-
don't know after 20.
This is a bonus one you can start doing too. If that wall squat feels good, that wall squat feels good, use
Okay.
a chair.
Okay.
Then that chair will allow you to slowly come down more and more and more.
More,
Then come up using your back muscles more.
Oh, okay.
And come back up.
yeah.
The wall, you're really not using the back is more for support on the wall.
Okay.
Here, more of a full squat here.
Mhm.
Come down, come back up. So
Well, I can go lower if I do in the swimming.
Good.
In the pool, you
There's
know.
more
the-
non-
the
non-weight
more-
bearing stress,
Because I
too.
cannot hold nothing, I just feel released, you know.
Let's go this way
Safe.
too.
Mhm.
One more time. But I want you, for this, I want you to do is focus on coming down, but keeping your back straight the whole time. So down, then back up.
Okay.
So
like-
don't do this.
Oh,
We're gonna keep
okay,
our back
like-
straight the whole time.
Like, okay, like that.
Good.
Oh, okay.
It's
Oh,
harder.
don't bending this.
It's harder. It's harder.
It's harder, yeah, it's harder that
Uh-huh.
this way, yes.
So bring your legs closer,
Oh, closer?
and now try that again too. Come
Oh,
down,
it's getting hard.
hold, and come back up.
Yes.
So as you get your back stronger because of the knees too,
Uh-huh.
come more forward,
Uh-huh.
and then lean down, hold, come back up.
Oh, okay.
Or we can come more upright again, like walking. Our body will stay here instead of here.
Yeah, okay.
Okay, so you want to exercise the same position we want our body to stay. Better posture, better position when we exercise, better back, stronger back.
Oh, okay,
Well,
that's
Sylvia,
great.
nice meeting you.
Thank you very much.
Two Sylvias today. It's natural.
Yes, we are serious and serious.
Natural Sylvias. Any- Yes.
I don't have chairs, I don't have chairs like that.
You can use a table, you can use whatever you want to use. Even a countertop too.
Okay.
Yeah. As long as you have enough, even this, for me, there's enough room here where I can go here and just come straight down, hold, come straight up. So all I need is a little bit, maybe like a foot ahead in front of you. That's all I gotta do. Any questions?
We like to dance.
Good.
We like when I'm dancing out there at the concerts,
Uh-huh.
that my knee is ready to go out. So what's
Uh-huh.
a good exercise, are these stretches good? I swear, I thought my knee was gonna just go
So
out.
a way to warm up your knee
Yeah, I need.
before you do all the breakdancing you like to do.
Cha-chas and,
all that
what else,
stuff.
what else?
Yeah, I do my favorite sneakers dance for a little
Okay.
bit, but I can move my body,
It's
but not my feet.
it's the rotation though. It's the rotation also. It's not this. It's almost like this.
Yes.
Oh,
So
okay.
get our knees warmed up for dancing. Want to do is use it, say, side of a chair or whatever you want to use. Even a bed's fine too. Bring your foot straight up. See how that feels.
Yes.
That feel okay?
Yes.
Yeah, it's tight.
Tight, good.
I heard
So you
it's
want
tight.
to do, I heard that, I heard the little click over there.
Yeah.
So you want to do now is make sure your toe is pointing right at you. When you bring that very top area, now point the toe toward you.
Yeah.
Hold that for a second
That's a stretch.
and let it relax. Good. Now you want to do is bring that toe out away from your body. Make sure the toe is pointed out. And now keep that toe out and bring that up toward you and hold for a second. Does that feel different?
Yes.
Well, it's trying to resist.
Resist you, right? Good. So hold that for a second and then come back down. And now, last one, bring the toe in to work the outside of the knee. Bring that up, hold for a second, and then come back down.
And do that.
I like 5, 5, and 5. This is your warm up those knees before you actually go dancing.
Well, we go out dancing, what, 3-4
Have
times
fun.
a week?
Have a blast.
Okay. Oh, good.
Yeah.
Good.
Easy.
But we have to stretch first. Again, stretch before activity, before our dancing, and then come home if anything is sore, make sure we ice it down and put the heat pack on. And we gotta make sure we're doing the right rehab after activity and not just run right into it. It just takes time. All of us. Any other questions?
Well, I can feel a sting right here on the side of my foot.
Because you're pulling it up. Yeah, it's tight.
It's a sting.
Yeah, because if the ligaments are tight on the side of your foot, so you can do also is with that same foot, if you want to stretch out the ligaments that come down your foot here and your muscles, mostly ligaments and muscles too, that come from the shin, roll your foot out and then slowly add pressure where it feels tight and just hold that tightness for about a minute. So you want to do, if I want to stretch outside of my ligaments and my ankle, I want to do is bring that foot out, roll your foot out, push down your knee on your knee a little bit, just control the pressure where it feels tight but not painful. Feels tight but not painful. And hold that for about 30 seconds to a minute. Ligaments, again, they need time to stretch, not the motion. They need more of the hold attention for the stretch. That's the plan. All right.
Is out is better than doing it.
It depends on what you're doing. So if you feel, it's more common to straighten your ATL ligament on the outside than it is the inside. But the inside you can too. It's a little kind of hard to do.
Yeah.
If this is uncomfortable to do on the floor, you can do is even to stretch the outside ligament too. Bring your foot across your body, and then bring that shoe or your foot. Look at the sole of the bottom of your foot. Hold that position. And if I'm going dancing and I sometimes sprain my ankles, I want to stretch out my ankles too.
Is this the right way?
Yep, that's the way. Yeah, that's the way. You can do that, and then much as you can, look at the bottom of your foot as you bring that foot toward you. Yes, Delia.
I'll go for leg cramping.
I like, and again, leg cramping, get it warmed up by doing this. By doing this extension stretch for the knee, you're also making the whole quad muscle relax, contract, getting the muscles to work more.
And how about against the walls?
That's fine too. That's fine also. Yeah, you can do that also. But again, a lot of it is, it's all controlled, right? If the quads are tight, hamstrings tight to make the back tight. Even your knees tight too. By finding a routine that works for you to stretch can allow your overall body to have a daily routine so we feel good all day long. In the morning, again, I'd say every time I get about 4:30 every morning, 4:30, go my stretch 50 minutes, and then go work out. That's my routine. What days do I do it? Every day. So I don't know what day it is. Sometimes I wake up 4:30 in the morning, it's all dark. I don't know what day it is. So I make sure I do it every day so I don't have to worry about it. I had a patient tell me this week, I do my stretches 3 days a week. I'm like, which 3 days? Sometimes Monday, sometimes I'm like, you have no idea. Because you lose track of the days. But doing it every day, you don't think about it, you just do them as part of your routine. I'm a morning person, get it done so I do it. Because the afternoon, things get busy, everything dog needs my care, my dog needs me for something. At that point, I want to make sure I get my stuff done early. All right? It just worked. But consistency. Whatever stretches felt uncomfortable when you try them at home, at that point, I like doing them every day. Make it feel comfortable, make your body looser and stronger so your back feels good all the time.
Another
Yes,
thing,
ma'am. Yes.
you're not supposed to cross your legs.
Why?
I forgot how.
If you have, good. My buddy had a full hip done, a full hip surgery. They cut him here, and replaced his full hip, and upper leg too. The first 6-7 months or so, it makes the ligaments more unstable, so you have to be careful of that. Once you've gone post-surgically, you can add more load to it. It's not a big deal. Not a big deal. If something pops out though, you can hear it from me. All right.
Well, does it catch your circulation?
It actually should increase your range of motion in your hip, but it may cut off some circulation in the back of your hip. Depends how much load you put on that side. It's
So,
in,
people like me, I sit, do puzzles,
yes.
and so I've got my feet down. My daughter-in-law was a nurse for 38 years.
Yes.
And she tells me, you've got to have that, you've got to have the feet up. You can't sit there and do puzzles all the time because you're not getting.
See, that's one theory, and a lot even corporates do the same thing too. Corporations. I recommend myself for your spine and your body to sit up more, have your feet underneath you here as a way to sit to help your spine and your body stay strong. Versus here, if my feet are up, what happens? I'm doing this again. I'm in flexion, making my spine contract and shorten the ligaments and muscles of the spine, versus an extension where I can come back more in a better spinal position. Cramping, little cramp. That point back here.
Chairs like this for, you can't.
The back of the chair's for decoration, that's all it is. Plus put colors on there and stuff.
Sit like this.
Put stickers back there.
Exactly.
Yeah, because we all want to lounge, right? We all want to do this all day long. Until we get up, we're like, oh, now I can't get out of the chair. So if you want to, and again, you can do this maybe 20 minutes a day, 30 minutes a day, at that point go back to what to do. If I'm going to sit like this, help my back stay strong. But if I get tired and I'm at home, I'll lie down on my couch or sit on my couch. At that point, if I'm lying down, there's no pressure on my spine. I can relax on my couch versus have to sit up on my couch. Some couches are too soft, too low, everyone's different. I just sit like this. If I get tired,
You don't go closer.
no. If I feel like I have to do this, I'm gonna lie all the way down on my couch, not on the chair, instead of wanting to sit slouched. I want to make sure my spine, my body stays strong here, not here. So I'll look funny. You should be a chiropractor. That. All right. Questions?
Something else.
Yes.
Neck pain.
That's 2 weeks from now. Again,
I thought today.
Today was about the shoulder pain.
how come I keep getting the wrong ones? I have to check my schedule.
That's why I came for the show.
We teach us
All right, one.
So I think I'm off 1 or 2 because we changed one. What was it, about 3 or 4 months ago? We changed one to a different one, so threw everything off.
So we talk about neck pain for 5 minutes?
5 minutes.
Okay, 5 minutes.
5 minutes. 5
I only
minutes.
have 5 minutes.
Neck pain.
That
Okay.
would be good for me.
Quick neck pain videos or stretching. Number 1, neck pain. Bring your right hand behind your left ear. Okay. Now, turn your head to your left shoulder, and then bring your head down toward your body. Good. So you want to do whatever arm you're working with, whatever you feel that pull. Turn your. So if I'm trying to stretch my left upper trap here, I want to do is bring my right hand behind my left ear, turn my head to my left shoulder, let the weight of my arm pull me down toward my body. Down.
If the pain is on the left side, you have to move to the right side.
So you want on the left side. To be on the left side, you want to move your right hand over your right arm over to your left ear, and pull down your head toward your body. Boom. Good. Good.
What about the cracks?
It's just more pressure in there.
And what do you do for that pops or cracks?
At that point, what happens is muscles are short. It's going to make the spine build up pressure. What you want to do is get that head further back to take the pressure off. So now, if I have my right side of my neck hurts, right side of my shoulder, I want to move my left hand behind my right ear. Now, turn my head to my right side, and then my head will go down toward my body. Again, my right-sided being sore, left hand behind my right ear. Hold that position, head down toward your body. Let that whole muscle stretch.
Yeah, I can feel it open.
All right.
Yeah.
You can if you want. It's not very effective. It looks funny. It's funny. It's always look funny. Any other questions? So again, if you want to get that neck to stretch, if your neck is stuck like this, you want the head to come further back to open that neck up. So you want to do is here, let your head, either in the chair or even on the couch too, let your head fall back and let it hold that position. Let the gravity push your head further back. Get that spine to open up and decompress that spine. Simple one.
Open your mouth and start snoring.
Yeah, that's what I normally do. Just hold that position. Say it again, 30 seconds to a minute. If you pass out, you pass out. You'll never know. Yes. 30 seconds to a minute. Hold that position. All right? Questions? 3 minutes. Another one. You're gonna use me for everything I'm worth, huh, Sylvia? Use me for everything I'm worth. Got it.
Counting all the minutes.
Got it.
Not to be finished on time.
Done. Here, take for example 2 water. I'll leave out one today because I only drink one at a time. Here, take 2 water bottles, hands open, come straight up with your shoulders. Come hold for 5 seconds. Come straight down. The goal with this one is make sure your head stays back against the wall, all the way up. Hold for a second, shrug exercise, come all the way down. Hold for 5, come up again. But keep that head back the whole time, looking forward. Yep.
Bring up your shoulders.
Shoulders up here. And hands open because it allows the spine to stay this way, not this way.
Oh, okay.
By having the hands open, we allow the whole body to stay open. Come straight up. Hold for a second. Come straight down.
And if we don't have water bottles, should we
You
walk
can use
out?
cans of soup. You know, chicken if you have chicken. I like chicken. Chicken noodle. Chicken noodle. It's up to you, but both sides even, all the way up, hold. And I use the wall just for now to start because you want your body to stay back here. Once you're comfortable, you come off the wall, hold that position, all the way up, all the way down. Again here, same thing, all the way up, and all the way down. All right. So
I
have,
have that, I have a confidence right now.
there you go. It'll help the muscle relax so it doesn't pop anymore. The muscles get stronger, they cause less pressure in the spine, so it doesn't want to pop as much. That's the plan.
And to sleep, you know, for the neck pain.
Yeah.
It's better to sleep with 1 pillow, 2 pillows?
1 pillow.
1 pillow.
Or no pillow.
Yeah, I also have
Yeah.
2 or 3, I think so that's why
Because it makes you feel good.
Oh,
Then all of a sudden you're like, wake up, you're like, I'm stuck here now.
I
You're back
already
here.
find my problem. I already
So
find my.
you want enough pillows where you feel support, but not where you're doing this.
Oh, okay, we have to sleep straight.
That's okay. Yep, exactly. Put a pillow. I put me in my hand here too for more support.
Oh, okay.
On my side. Yeah, go for it. Go for it.
Okay.
Yeah.
What is a good walking position for outdoor walking?
What do you mean?
When you're walking outside?
What do you mean? Walking on the street?
Yes.
Okay, so say same thing. Roll your feet when you're walking. But keep your head up enough. What I tell people to do too is look down with your eyes, not your nose.
Okay.
So look with whatever your peripheral vision is, up and down. Look down with your eyes further out, not here with your nose. Your whole body does this. Ugh.
Okay.
Keep your body up and look down with your eyes.
So before you think you're gonna fall.
Exactly, most people do. That's their fear. If I can look with my eyes and have a stronger back, better balance, I'm not going to fall. This takes time to build that strength here so you don't feel like you have to do this. And then your vision, your balance become better too.
Yes.
If your back stronger back, better balance. Stronger back, better balance.
With the neck.
All right.
Because I'm always looking down and she went,
All right. Is my time up, Sylvia? Am I good?
Yes, you're good.
Can I go to lunch now?
Yay.
Thanks for watching.
Yeah.